Hey there, it's Dr. Jim with another great topic. Thanks for stopping by. I hope you find this interesting. Age-related frailty and how to help. So stand by. This is a concept we've only been studying over the last couple decades in gerontology or the field of aging. So as you know, aging can take many paths throughout one's lifetime. Some older adults will age well with few major health problems, and then others are going to experience poor health with numerous comorbidities and medically complex conditions. A newer concept in the study of aging is one that many medical professionals are encountering, and they're trying to prevent, delay, or hopefully reverse. Okay? The condition is loosely called frailty, and it is becoming more common. Researchers are still trying to more accurately describe and define frailty, as it is a newer concept. Some define it loosely as a range of physical and mental health conditions in older people, including debility and cognitive impairment. Others say that it's a clinically recognizable state of increased vulnerability associated with increased aging, a decrease in reserve and function, and a diminished ability to effectively handle daily stressors. So, increased frailty leads to a higher risk of adverse health outcomes, negative outcomes. So, frailty in and of itself is not the only problem. Everything that it is associated with, on the other hand, leads to issues that can become very problematic in the lives of frail seniors. With increased frailty comes more risk of adverse outcomes, including disability, multiple hospitalizations, poor quality of life, being admitted to a skilled nursing home, and earlier death. Frailty can also lead to the following: decreased physical activity, falls with injury, cognitive decline, decreased nutritional status, and depression. So, what are some risk factors? Let's take a look at these. The concept of frailty in itself can be very confusing because some of its causes also end up being the adverse outcomes that it creates or leads to. So in one sense, it's sort of a circular concept. Some risk factors for what some researchers call frailty syndrome include the following: aging, unhealthy lifestyle habits, low physical activity, poor nutrition is a risk factor, poor living environment, comorbidities, polypharmacy, which is taking a lot of prescription medications, genetics, and the simple fact of being female places the individual at a higher risk of becoming frail later in life. So what can be done? Let's talk about that. Early detection of anything is very important. Early detection, diagnosis, leads to better and more appropriate medical intervention, and this can make a big difference in preventing, delaying, or reversing the effects of this syndrome. Frailty screening and multidisciplinary intervention should begin as soon as possible to prevent poor outcomes and reduce mortality rates among seniors. Some very important takeaways. Prescription meds are important. Those that are actually appropriate for that individual should be adhered to. So adherence to medications is a must. Assessment and prevention of falls should also take place. A frail senior falling could be deadly. So here are some risk factors for falls: living alone, polypharmacy, a sedentary lifestyle, impaired cognitive function, impaired vision, malnutrition, and excessive alcohol use or substance use. Lots of risk factors. So some things to think about now, because a lot of this is preventable. And then exercise interventions. You know the old saying, use it or lose it, definitely applies here. But we're talking about elderly people. We're talking about people who might be in their 70s, 80s, 90s. Maybe they're frail already, maybe they're not. So you just can't say exercise. You have to take things into consideration like frequency of exercises, duration of the activity, intensity of exertion and resistance, the type of exercise. Is it going to be a balance, exercise, aerobic endurance, flexibility, so on and so forth? And then compliance. Can the senior perform these exercises safely by themselves, and will they do so? And then interventions for mood and cognitive function are equally as important, because there are lots of situations where individuals who are frail, malnourished, not moving around a lot, so on and so forth, have a tendency to become depressed. So an assessment of the individual's mood state, their cognitive state, should also be considered as well. So there you have it. I have a wonderful article that you can read that has a lot more information in it, but I thought I would give you some of the bullet points on frailty as we age and what we can do about it. So I'm Dr. Jim. Thanks for stopping by, and I hope you keep coming back for more good information. Thank you so much for taking some time to watch the video. I appreciate it. And if you're a licensed healthcare professional who's looking for some great continuing education, we've got it. And we are always working on brand new, fresh content for you. So you can find the link to the website in the description, and keep coming back for more information. I hope to see you soon.